Since this is the Love Month, we are titling this webinar, How We Fell in Love with Fighting Fraud. So my teammate, Suzanne Taylor, and I are going to share some of our favorite stories and experiences from our careers that built our love for fighting fraud. So hey, Suzanne, so why don't you
Hi.
start by sharing with everyone a quick recap of your career to get us
Okay.
started?
Sure. Um, so I have a degree in journalism, and I worked at a local TV news station, working on all kinds of crazy stories. And I did that until 9/11. Obviously, I was a little burned out from that, so I felt like it was time for something new. And I got into federal background investigations. I did security
Cool.
clearances for OPM, and I did that for about 7 years. And from there, the contract I was on was ending, and so I was looking for a new role, and I applied for fraud investigator. I just didn't realize it was for healthcare fraud. I thought it was more like background stuff that I was more familiar with.
Sure, yeah.
But, I just jumped into the deep end of the pool and became a fraud investigator for Medicare. And from there, I worked mainly Part B and DME. So I learned a lot in that first few years. And from there, I worked for a contractor for a while, and then that contract ended also. And then I got into commercial fraud investigation.
Mhm.
And now I'm in the consulting world. So it's been an interesting journey. How about you?
So it's crazy that you say, sounds like we've had similar backgrounds, and since we just live probably 30 minutes apart, so that's a fun fact for everybody, that just to show you how small this world really is, that we started working together on August the 1st, and that's when we realized Suzanne lives on the south side of downtown Fort Worth. I live on the north side, so we're that close, and still yet our careers have sort of meshed or gone down the road with one another. So a quick recap for me is that I was a Medicare fraud investigator in Houston, Texas, for a Medicare federal government contractor for 8 years. So I conducted unannounced on-site inspections and investigations on thousands of durable medical equipment, prosthetics, orthotics, and supplies providers and practitioners, pharmacies, and even some home health agencies, hospice, labs, and so forth. And I was able to do that really not only just in Houston, but around the country as well. And then the biggest part of my career is I had 25 years working for the Centers for Medicare and Medicaid Services. I was with them when they were even the Healthcare Financing Administration, or HCFA. So I've been through CMS and HCFA. But during all those 25 years, a lot of the time I spent as the policy lead for durable medical equipment, prosthetics, orthotics, and supplies, home health, hospice, fraud, waste, and abuse. And further on in my career, I was really able to hone in on my fraud experience when I became a government witness at some DME and high-profile home health fraud trials. So we've had similar experiences, and even though we live just miles away from one another, we've not met up yet, fajitas and
We
margaritas, but we're
will
going to
fix
have
that.
to. Yeah, we've
We
got to
will
fix
fix
that
that.
today. Okay, so getting into the nuts and bolts of it all. So I think the question is, how did you land in the world of healthcare fraud?
Well, like I said, I was leaving the government background investigation side of things. I applied for a job as a fraud investigator.
Hmm.
And when I went for an interview, the company was a little vague, the job description was a little vague. But once I got in there and I asked, like, what is this role for? Can you give me a little more insight? And it was on healthcare. And they said, what do you know about Medicare? And literally, my answer was like, I know it's insurance for older people that the government pays for. Little did I know that I was going to learn a whole lot. And
Yeah.
because of my background and my interviewing skills, they hired me on the spot. And within a week, my first case was on an ambulance to
Oh,
nowhere.
oh yeah.
Yeah, so I was just fascinated to learn that one ambulance with two patients can make $1 million in a year easily. And just back and forth, transferring to facilities. And then from ambulance, I moved over to DME cases.
Yeah.
And I learned a whole new world existed with DME fraud.
Oh yeah.
Um, so that's how I got into it.
Mm.
How
Well,
about
to, tr
you?
to try and tie in with your ambulance, yeah. When I was with Medicare, we went to, I think, Little Rock for some health law enforcement meeting, and one of the presentations was on this ambulance fraud. And literally, the scheme was that they were billing all of their ambulance frauds and everything, but of course, they were just taking patients from the nursing homes to their dialysis treatment,
Yeah, right?
which was clearly and utterly not within the realm of the policy or the guidelines for using ambulances. But it, it was very easy to make $1 million. It was easy to make several $1 million running an
Yeah.
ambulance in a year, especially when you're doing it illegally. But yeah,
Right?
but yeah, I guess my first, like I said, my first lead policy when I started with CMS was in fraud, waste, and abuse. I was on a team that had oversight of a Medicare contractor, the Durham Medical Equipment Regional Carrier, and I specifically was pegged to sort of oversee the contractor's program integrity unit. So that's where I became familiar with fraud allegations and investigations, and worked with the contractor to suspend the payments to those providers that were falsifying records or willfully misrepresenting records.
Right.
Back when I started doing this in the 90s, it was really easy to get a provider suspended. You did have to go through your general counsel, but everything, and it wasn't too hard. But good Lord, now it's almost you have to give your first child's blood before you can get a provider suspended these days, or it used to be
Yeah,
that way anyway. That was years ago, so forgive me, CMS, if I'm talking out of turn. Um, but that just really helped me prepare for working with law enforcement, and it's work that I loved and invigorated me. My degree's in criminal justice, not that I did anything with it, but this sort of makes me think I'm doing a little something with criminal justice. So, but
okay.
then, yeah, after those 7 years of being in CMS policy, that's when I went to Houston for my fraud investigator role. So we have had those similar experiences and all that fun that
Definitely.
goes with ambulances and DME and every other kind of fraud.
Right?
So let's, if we can now, let's picture a crystal ball in front of us. So look in that crystal ball. Some things that I think would be interesting to share with everybody is what was something that challenged you, surprised you, or maybe even still gives you chills?
Okay. So for the challenge question, I would say I was doing an investigation on a provider who um, was supposed to be in person providing oversight on patients receiving Remicade infusions.
Oh, wow.
And when I went to do his interview, I sat in his office and he had pictures everywhere of him at the Beijing Olympics, the opening
Well,
ceremonies,
there you
all these
go.
events, the
Yeah.
closing ceremonies. So I was, and this wasn't just like, oh, here's a picture. They were large
Oh,
framed
yeah.
photos. And I asked him, I said, were you there for the whole time? And he said, yes, I was. I was like, wow, that seems like a really fun trip. And um, so after doing the interview and seeing how proud he was to be at the Olympics, I went back and looked at my claims history, and he billed that he was treating patients when he clearly was in Beijing. Um, And so I documented all of that, and that was part of my findings and my referral to the FBI and OIG, and they accepted the case because it was rock solid. There
Oh
was no
yeah.
disputing that he was not in his office treating patients.
Well,
So,
a lovely little memento picture could just really
right?
wreck your fraud life all straight to hell. So,
Yeah. As far as the challenge, I would say I was
excuse
working a DME case in the Houston area, which I know you're very familiar with,
me.
and I found that I was there to do interviews with Medicare beneficiaries
Oh
to
yeah.
see if they received these orthotic devices that we lovingly
Oh
refer to as a
yeah.
mummy kit.
A
And
mommy
so
kit. Gotta love them.
a
Yeah.
lot of these were like an ankle brace, a knee brace, wrist, elbow, you name, back
Oh
brace,
yeah.
neck brace, everything. Um, but sadly, this woman that I interviewed was a double amputee in a motor scooter. Clearly, she did not have the limbs to support having knee and ankle braces. And
Yeah.
so I realized that this is probably a bigger scam than I just stumbled upon.
Yeah.
And that tied into the wheeler dealer
Oh yeah.
operation that
Absolutely.
I think you had a hand in as
Yeah.
well.
Very familiar with. Yeah. So.
Yeah. And then I guess the chills, um, there was a very, very prominent doctor in Dallas who would drive around neighborhoods and hand out frozen turkeys and grocery store gift cards in exchange for people's Medicare numbers. And he's now in federal prison. So I had a tiny little part in that case. That was the Houston um, DME tied back to Dallas
Yeah.
DME and home health. So
Well, that lovely doctor you're talking about, see, I don't know how we've never met before. Our lives at Advise on August, because yeah, I was on the witness stand for 8 hours during that trial for that wonderful doctor
yeah,
that was falsifying everything and had I can't remember how many home health agencies that were he was signing scripts for and doing all these authorizations for. But at the time, it was the largest Medicare fraud that had been perpetrated by home health providers and doctors. So
I
yeah, I
remember
mean,
that.
I was on the stand for like 8 hours, and it was just terrifying on top of exhilarating. But a fun fact that it just made me thought of that the church I was going to at the time, a lot of the people knew that I worked for Medicare. And then this lovely couple came up and said, "Do you work for Medicare? And did you know this case and this person?" I was like, "Oh yeah," and we started talking about it after he'd been found guilty and all that. They were like, "Yeah, so they had to sell all of his homes and his cars and everything. Yeah, we bought one of his houses."
Oh wow,
So yeah, I was having my friends
small
at
world.
church were letting me know that they were able to make off on get some really good deals on, because when you steal that money, you got to do something with that money. You got to buy
Right.
houses, cars, boats, all that kind of good stuff. So, well, that's
Other
awesome.
businesses.
I know, yeah, there's lots of other businesses I think we've encountered just in the short time we've been together on Advise
Yeah.
that people may be engaged in.
Mm-hmm.
So, but to think about all the things that I've done in those 8 years that I was in Houston, I mean, there's just so many, it's hard to narrow them down. But some of the things that I thought about that whenever I first moved to Houston, again, it was literally at the height. I left CMS to go to work for the contractor and go to Houston in the height of the wheeler dealer scam.
Right.
And of course, it's if anybody's unfamiliar with it, it's when suppliers were trying to get numbers so that they could build electric wheelchairs. Let me put in air quotes. These electric wheelchairs, when all the claims and the bells and whistles are submitted to Medicare, they reimburse for almost $6,000 or more dollars per claim. That's reimbursement. So
Mm-hmm.
of course, that really heightened everybody's interest in getting wheelchairs to all the poor people that need those wheelchairs. And there was and is still strict criteria on the eligibility requirements for qualifying to obtain motorized wheelchair vehicles. But at the time, we were getting thousands and thousands of applications around the country just for people that wanted that Medicare number so they could bill that $5,000 plus claim to Medicare. Um, I was able to go to the manufacturer's wholesale distributorships and all, and see these wheelchairs don't even cost $1,000. So the markup is huge. So this is what everybody really wanted. So we got into that, and I guess what was challenging, what I learned was that these applicants all over Houston's I think the fourth largest city in the country, and there's tons and tons of office space, but literally people were buying up every 100 square foot business office and suite if they were even 100 square feet. That's 10 by 10, I think, if my math is correct. But literally, so it was just enough they could put in a desk and a chair and a phone, the 10 commandments on the wall. And they would have a wheelchair and a cane. I mean, they would have a wheelchair, not even a wheelchair, I'm sorry, a crutch, a pair of crutches and a cane. That would be the typical inventory that they would have. So that was their introduction into being a DME company. They just had that cane and the crutch. So if you've been in Houston, you know there are streets like Fondren and Hillcroft and Bissonnette and Harwin, all those. And for anybody that's not familiar with Houston and those areas, but if you've been in law enforcement or investigations in Houston area, you know that literally there are buildings, they're just pods of buildings, and there are hundreds fly-by-night DME suppliers inside of those single buildings. That could be 500 suppliers in a building if there were like 10 floors in the thing. So and I guess the fun part for me was after I got there and was doing all of these investigations and inspections, that I think once they realized there was this little short white man, I'm 5'4", so I'm not a big presence, but I was stomping around these buildings in my Doc Marten clogs. That was my uniform, looking for all these people that were trying to get a supplier number. Literally, after a few months, no matter what building I went in, I could see eyes. I could see heads start out. Eyes were watching me. I learned I became really stealthful about finding hidden stairwells or these office suites that had exits out the back or whatever I could do to get in and out of buildings as quickly as possible. So I guess a surprising thing was the fact that a city of Houston, an old historical city, they don't zone the city. So anybody could have a company anywhere, in your home, in your apartment, in your trailer house, in your nail salon or hair salon or smoke shop, whatever it may be. So I would always have to go into these facilities, and there are supplier standards. We do have DMEPOS supplier standards over the course of the years. I think it's 42 CFR 424.57C. Don't hold me to it. I seem to have said that so many times, and I think that's right. But we would just have to go into all of these buildings and determine whether or not they were in compliance with the standards. And I somehow could always find a way to fail an inspection, just to slow down that application if I could, but there was always something that was out of violation. And I know I've talked a lot, but I have to mention this. The thing that sort of chills me, I don't know if it chills me or just pissed me off, was this story I love to tell. So I went to do an inspection for this DME company, and the address was an apartment complex. I was like, okay, been here before, done that. So I find the door of the apartment and I knock on it. There's no signage or anything outside to let me know that that's a company in there, but I knock. We have to knock. So I knocked, and there was a lady that came to the door, and I showed her my badge and what I was there for, and she said, "Oh, come in." So she was a pregnant lady, a very pregnant lady, and a lady much taller than me. Like I said, I'm 5'4", so almost everybody's taller than me, but very pregnant. She came in, and as soon as I came through the door, this is an apartment that has bars on the door and on the windows. So she locked the bar door, and then
Oh
she
no.
deadbolted the front door.
Oh
And
goodness.
then the next thing I knew, she took the keys and threw them through the kitchen to the back door. Uh, and I was like thinking in my head, good Lord have mercy, what have I gotten myself into? So then I, my mouth just said, let me tell you something. You've got 2 seconds to get those keys, open that door.
Right.
And I said, otherwise, your front bay window is going to be shattered glass because I'm about to start throwing every piece of your furniture
Oh
through it.
my gosh.
So, and then I said, one. And she took off, got the keys, came back. Long story short, she unlocked the door. That gave me enough time to write out the notice saying I was here to do an inspection. And nobody, the owner was here. The owner was her husband, who, of course, had just stepped away, but was going to be back immediately.
Oh
So
yeah.
she was locking me in there until he got home, until she could call him to tell him to get there.
Oh my
Or she
gosh.
thought she was. But
Right.
yeah, so that's the thing. That's probably one of my more fond stories of being almost kidnapped, I feel like. So
That is funny and scary at the same time.
I know. Yeah. So I dropped the notice on the floor, and I know some of you may judge me that was not very Christian of me, but sorry,
Well,
it was how I felt at the moment, and I'm not from that generation that everybody deserves a trophy and not everybody gets a chance.
no.
So okay. So you've heard me talk. So you talk a little more, Susan. So Suzanne. So let's talk about the things we thought we would never do.
Well, I have toured some very shady nursing homes and felt very sorry for the people and the
Oh
conditions
yeah.
they were
Oh my
in.
gosh. So much.
I have investigated providers and found that they were tied to other providers that I would have never suspected. You know, some of them were a dynamic duo of you send me your patients and I'll make
Yeah.
money and you can make money and you know, kickbacks are a real thing.
Oh yeah. Absolutely.
I found some other, you know, inappropriate relationships of, you know, nepotism and family members. Some of businesses were in pets' names, children's names. So it was just interesting to see, like, wow, okay, that's your where your moral compass is or
Yeah.
isn't. But I never thought that medical healthcare fraud investigation would be tied to and involve organized crime.
Oh yeah.
And I've seen that in the Medicare
Yeah.
world. And now I've seen it in the commercial world. Actually, we have, I can't say names, but we have cases where they're all in the same building and they
Correct.
know each other.
Yeah.
Yes. And that we stumbled upon. And that has been very interesting to me to see the other ties that came out of that. Some other businesses that have nothing to do with healthcare, but certainly are probably involved in fraud. And that's why I love this business is that,
Yeah.
or this line of work, because it's something different every day. You
Yeah.
never know what you're going to find. I love puzzles, so this is like putting a puzzle together. So
Truly.
that's, I would say that would be my, I never thought moment would be organized crime.
Yeah. Oh, and I agree. After all the years of the things we've seen, and luckily, like I said, I've been able to travel to different high-profile cities like Miami and Los Angeles and Las Vegas and
Hmm.
all those places, and it just amazes me all of the familial ties and the other ties of how people get involved in this and the extent they go to perpetrate healthcare fraud because it is so lucrative when you can
Right.
make millions and millions and millions of dollars and literally almost have to do nothing. Then
Yeah.
all we can say is Jesus will get them. So, but I guess the one thing for sure that I thought I would never do. I didn't even think about my involvement in all the cases that I was with, but I was able to get in Houston with all my investigations and all of the reports and everything I was writing. I was amazingly invited to start attending all of the strike force meetings
Oh, yeah.
that they would have. They had one in Houston, and they would have strike forces with all law enforcement agents and departments all over the country, all over in many cities. So I was able to sit in on those and got to meet so many wonderful agents and uh, representatives and other people that have just truly helped build me and teach me all of the things that I can do now or I know to look for. So, but the one thing I
Right.
never thought I would do would be that I would have to actually get up in front of a court and testify. So I guess the first time that I found out I had to do that, it scared the willies out of me. But I just knew that everything that I had to substantiate the work I'd done, it was perfectly fine. And all I had to do was just get up and say what I'd done. And so I think the first trial that I went to, I just, of course, prayed God knows how many all the night before and at the courthouse sitting on the bench. But I walked up and just got there, took a deep breath, um, and just said what I had to say. And when it was all said and done, one of the bailiffs stopped me on the way back and said, "You just need to do that every time you sit down. Just tell it
Wow.
exactly how it is." And I was like,
Awesome.
"Okay." So in all the other, I probably testified at a couple dozen trials, and usually there's one of my agents or the bailiffs now in the courtrooms that I would go to. Right before I'd go take the stand, they'd just whisper, "Go do your thing." And I was like, okay, that's what I needed to calm me. But yeah, I thought I'd never do that. Oh, I have so much fun. But when you're sitting in front of a room that everybody's looking at you, you're dressed all pretty and you're
Oh,
looking
yeah.
good. So everybody has to listen to every word you say. So what's not to have fun about that?
Right?
So, well,
I'm
I
sure you
know.
love that part of it. I'm sure you love
Oh,
the
how could you
dressing
tell that
up.
I love to be the center of attention and talk about it and have people look at me while I'm dressed in all my finest? So,
I'm sure, absolutely.
but I know we've talked a while, so we want to try and wrap it up. So, I think what the last question I could think of was, why does this work matter now more than ever? And why do you still care so deeply about it?
I care because I have learned to become an advocate for my parents. I've learned a lot of what to avoid. I feel like I can navigate them away from scams. I can direct them towards a good provider, a good facility, and I know that they're not going to get scammed or hustled. And that's why I care that I could be an advocate for my family and my
Yeah.
friends.
Oh, absolutely. And mine is exactly the same. I mean, I had never I didn't start working for Medicare until I was like 31. And but all of the years that I was able to enjoy and have that knowledge and experience, I was able to guide my precious mom and dad, my aunts, my sister, friends, people that I went to church with. You guide them through once they learn who you work for and what you do, then they will come to you with questions, which is perfectly fine. But I, I felt it a privilege that I was able to guide them through the pitfalls of all the Medicare enrollment questions, co-pays, deductibles, drug plans, all of the coverage denials and appeals. I mean, old people, and I'm old now, so I can't say that. I should say elderly people that were my parents at the time. It was just overwhelming for them. They just couldn't
Right.
maneuver those pitfalls, and no matter where they turned, everything would be turned upside down. So I just felt that I was blessed to be able to help them, and whenever I started my career with the government and with Medicare, I decided if I'm going to be able to help my mom and dad, then I have to help everyone else just as much. So I literally took on everybody else's, every beneficiary. They were my family. So you just have to
Oh,
help them. You have to have an advocate for them. And they will just drive you crazy sometimes.
yes,
you know,
true.
but they earn the right to have the healthcare coverage that they've got through Medicare and Medicaid, whatever it may be. So
Hmm.
they deserve our sympathy and they deserve our attention. Because everybody struggles. I mean, with
Right.
everything they're doing, with whether some people, I mean, I've seen my parents struggle about they would cut up their pills to make them last
Yeah.
longer
Right.
because they didn't want to pay so much for them. So
Mhm.
I think that my experience has just made me more of a staunch advocate for anyone that's going through any kind of healthcare crisis or instability or anything that I can do to help them in any way that I can. It's meant so much to me, and I feel like that's what I was called on this big old round ball to do. So
That's wonderful.
yeah. So, and I know how you are with your parents, and I know they appreciate you greatly. So just know that they
Well,
may not
thank
always
you.
say it, but
Oh,
know they
right.
do in every way that they can. So,
Yeah.
and with that, everybody, I think that is probably enough of y'all hearing on about from us on how we fell in love with fighting healthcare fraud. So we hope
Right.
you've had fun. If nothing else, maybe it's been colorful. We have both have beautiful, colorful black backgrounds. So you just had something to look at. So, and with that, Suzanne, I have decided that I think that we are going to be taking administrative leave.
Okay.
Um, and now after this is done, so let's just meet up in the stockyards in like an hour. And we'll have fajitas, mainly margaritas though. Now,
Okay.
what we had to do is decide on how we're going to get how to expense this to advise. So,
Okay. Sure.
but don't tell anybody. All
No.
right. Okay.
Sounds good.
With that, bye everybody. Take
Okay.
care.
Thank you.
Thanks.
See ya.